And turning now to today's installment of Yahoo Finance's week-long special healthcare industry checkup, let's get to Yahoo Finance's Anjali Kemlani.
Thanks, Josh. As part of Yahoo Finance's Healthcare Week, we're taking a look at the modern era of the health industry. Non-traditional players such as Amazon and Walmart have been dipping into the healthcare space, responding to a demand for more consumer-friendly healthcare systems. Meanwhile, there's traditional giants like CVS and United Health Group, and they continue to fuel their expansion in a consolidated industry that is desperate for greater efficiency. This all leaving patients to navigate a new age in healthcare, sometimes outside the bounds of insurance coverage. Here to discuss is Daryl Toll, General Catalyst Head of Health Assurance Ecosystem. Daryl, great to see you. How are you today?
Doing really well. It's nice to see you as well.
Thanks so much for joining us for this special. I know that you are also a former hospital CEO, and this is why we have you on to talk about this today. I want to start off with talking about these moves that you just heard me talk about, all these large companies getting into different parts of the healthcare space. We know that traditional players like CVS, we know as a retail pharmacy giant, but now so much more than that. How is that disrupting what is the traditional healthcare routes that patients navigate?
Well, I think you see a lot of organizations entering the space because of strategic alignment on their part, which creates bounded transformation. I think they are addressing needed change in parts of the system that are associated with their strategies, but then those changes will end when you hit the edge of their boundaries, their strategic objectives. We like the learning, the opportunity that comes out of those, but we're nervous about the fact that transformation across a system, across lifetimes, isn't going to happen based on these bounded strategic efforts, even if the players are unusual. What we're looking for is, how do you create transformation of this many-headed monster called healthcare that has frankly become too complex, lost sight of the consumer, and left a lot of open space that is not yet being addressed for change. And that's something I think that still needs a lot of attention.
Well, and that's where players like Amazon and Walmart come in. We see them sort of, if you will, eating around the edges of the traditional healthcare space, finding the sort of low-hanging fruit and low-cost patients that they then transfer, by referral or other methods to these healthcare systems. I wonder, in this day and age, we know General Catalyst has been looking at, running a healthcare system. I know you're not part of that team, but in the announcement for that, part of what was announced was the idea that this move would then help to create, quote, more profitable, more vibrant, and more innovative systems that serve these patients. I wonder about that profitability part of it. You yourself know what it takes to run a healthcare system. Right now, we're looking at, like I mentioned, looking at these, low-hanging fruit options. Does that sort of create an imbalance of our health ecosystem today that was very focused not too long ago on value-based care?
Value-based care is important, and if you think about value-based care, it's realigning incentives around proactive versus reactive models of care. As importantly is connected care across all of the types and requirements of care, and connected care across a lifetime. And as important as segmented efforts can be in experiments around ways to experience care differently, or maybe a more consumer-friendly approach to care, that longitudinal lifetime of care is most likely to happen in organized systems of care like regional healthcare systems. That's why General Catalyst has put our stake in the ground with healthcare systems to say, yes, it's a difficult time, but the future is bright. It has to be bright. The best options for connected care exist within really well-run, well-built, transformed regional systems of care, and we want to be part of that. So we're looking to build machinery beyond the core of General Catalyst's storied history is venture capital, stage agnostic venture, and a growing healthcare practice there. But we're looking at building partnerships, an ecosystem of change with some of the top health systems in the country. We've started a not-for-profit, and you mentioned, of course, the health assurance transformation company that Mark Harrison, former CEO of Intermountain, has come in to run. All of these are pieces of a big vision coming together because healthcare is hard and because healthcare requires a long-term effort that connects to healthcare systems.
So is it basically we're at a point where we have to experiment because we all agree that the current system is broken?
The current system is functioning in some ways, broken in other ways, and in total feels very frustrating to experience. And I think we should preserve the functionality where it exists, and it does exist. There's plenty to celebrate, but it'd be short-sighted to just celebrate in the midst of so much failure. So we're looking at all of those spaces where transformation is needed. Where have other industries transformed? Usually there's an element of connectivity. Always there's an element of consumerism. Often there's a change in incentives. How do those things combine to drive the kind of change that needs to happen in healthcare today?
At the cost, though, of patients out of pocket and in general, a lot more cost to the system, isn't it?
At the end of the day, a connected care model that connects care and coordinates care and provides better information streams and integrates the consumer and decisions being made will drop the cost of care. Realigned incentives that feature value over volume will lower the cost of care. It's an imperative. It must happen. I will say, though, value-based care is not synonymous with transformed healthcare. Systems that have essentially value-based care incentives holistically across their network still lack access and consumerism and can be very challenging to navigate. So we have a big project ahead of us.
Definitely. Well, we'll all be watching, and we're definitely watching this healthcare system as it unfolds. General Catalyst Darrell Toll, thank you so much for your time today.
Thank you.